trying to understand the mode of failure is key with any revision consult, understanding bony deficiencies and ligamentous integrity as well as the components that are in place. But I think the biggest key, and we were sort of alluding to it in the last talks, is that pain is not an indication for revision. If you have a patient that comes in like this and they say, hey doc, my knee hurts and my total knee never really made me better, oftentimes if I don't see anything really obvious on their workup, ask them to get their old radiographs. And if you get their old radiograph and it looks normal, well then your chance of making that patient better is quite low. And when we're evaluating any painful total knee, understanding the reasons that knees fail is key, and I think the key 3 reasons to understand are infection, instability, and loosening. If you look at most registry and single series reviews, this is a series out of Ortho Carolina 2001, infection, instability, and loosening, most common causes. Here's another series of 6 centers in the U.S. from 2010 to 11, so a little bit more contemporary series. Again, loosening, instability, infection, the 3 main causes of knee revision. The AJR in patients younger than 65, the most contemporary series here, 2012 to 20, still infection, aseptic loosening, and instability. So when you're evaluating that painful knee, those are the things that are sort of on your mind as the 3 main causes. What are our diagnostic tools in 24? Well, unfortunately, we don't have any magic tools today that we didn't have before. History and physical really is the main one. Radiograph, serologic test, aspiration, and then occasionally a nuclear scan or CT study, and we'll talk about those. So history and physical, I think it's the key to all things. It's a careful history can raise red flags that make the diagnosis easier. If the patient comes in complaining of a history of wound healing problems, prolonged drainage, cellulitis, or really this lack of a pain-free interval, really think about infection, and I would tell you to think about infection in every case that comes in that's painful. If they had a history of startup pain or the first few steps hurt more than the next 10 steps,